Welcome back to QBankPro Academy for another Q&A with detailed explanations. Join thousands of nursing students who have used our instruction. Remember to sign up for free resources with the link below, including a study guide, 75-question exam, quizzes, and more. Let's get started. The unlicensed assistant personnel, UAP, asked the nurse about risk factors for gastroesophageal reflux disease. GERD. What foods should be avoided in patients with GERD? Select all that apply. A. Caffeine. B. Chocolate. C. Peppermint. D. Alcoholic beverages. The correct answer is A. Caffeine. B. Chocolate. C. Peppermint. And D. Alcoholic beverages. Explanation. Patients with gastroesophageal reflux disease are cautioned to avoid or eat certain foods sparingly that may worsen symptoms. These include A, B, C, and D. Some healthcare providers also counsel that fried foods and high-fat foods should be avoided. A patient is admitted to the hospital with suspected gastroesophageal reflux disease. What is the examination of choice for evaluating gastroesophageal reflux disease and gastric ulcers? A. Chest X-ray. B. Colostomy. C. Upper GI with contrast. D. Upper endoscopy. The correct answer is D. Upper endoscopy. Explanation. Esophagogastroduodenostomy, EGD, is a procedure that uses a long scope with a light at the tip, inserted through the mouth to inspect the esophagus, stomach, and duodenum. Biopsy can also be done with an EGD scope. A patient is admitted to the hospital with heartburn. What is the upper gastrointestinal series used to examine? Select all that apply. A. Esophagus. B. Pancreas. C. Stomach. D. Duodenum. The correct answer is A. Esophagus. C. Stomach. And D. Duodenum. Explanation. Upper GI series involves drinking a barium mixture and an X-ray to see the esophagus, stomach, and duodenum. It is not the preferred study to evaluate GERD, but it still has a role in some cases for evaluation. When combined with a small bowel follow-through, it may be used to examine the small intestine. I hope you're starting to feel more comfortable with these GI questions. Let's keep going. What should be recommended to the patient following an upper GI series examination after oral administration of barium? Select all that apply. A. NPO for 24 hours to allow the barium to pass. B. Drink fluids. C. Drink 16 ounces of activated charcoal. D. Take a laxative. The correct answer is B. Drink fluids, and D. Take a laxative. Explanation. After a barium study, the patient should be instructed to drink lots of fluids, eat foods high in fiber, and take a laxative to encourage removal of barium from the gastrointestinal tract. What two postoperative complications occur after meals in patients who have undergone gastric surgery? Select all that apply. A. Postprandial hypoglycemia. B. Postprandial hyperglycemia. C. Diabetes insipidus. D. Dumping. The correct answer is A. Postprandial hypoglycemia and D. Dumping. Explanation. Surgical procedures that involve gastric resection, removal of a portion of the stomach, and reconnection of the stomach to the small intestine may lead to postprandial low blood sugar and dumping. Symptoms include sweating, palpitations, abdominal pain, and diarrhea. Which of the following can be performed by an unlicensed assistive personnel, or UAP? Select all that apply. A. Assessment of drainage. B. Skin care. C. Location and assessment of pain. D. Oral care. The correct answer is B. Skin care and D. Oral care. Explanation. Unlicensed assistive personnel provide valuable patient care. Their responsibilities include documenting and reporting, assisting with rehabilitative tasks, taking and recording vital signs, and observing patient activities. The nurse is caring for a patient in the intensive care unit, ICU. What is the best way to provide oral care to patients who cannot perform self-oral care? A. Flossing the patient's teeth after each meal. B. Rinsing the patient's mouth with mouthwash. C. After every meal, a soft toothbrush should be used to brush the teeth. D. A toothbrush may be used to brush the teeth in the morning and before bed. The correct answer is C. After every meal, a soft toothbrush should be used to brush the teeth. Explanation. Patients in the intensive care unit and patients who cannot provide self-care require good oral care. The teeth should be brushed after every meal to maintain the dentition and gum health. Oral care and inflammatory conditions of the salivary glands may be included with these types of questions. Let's try one. A patient is admitted to the hospital with parotitis. What is parotitis, and who is at risk for the condition? Select all that apply. A. Parotitis is a soft tumor of the parotid gland. B. Patients at risk are those with poor fluid intake. C. Patients at risk are those with lack of oral care. D. Parotitis is inflammation of the parotid gland. The correct answer is B. Patients at risk are those with poor fluid intake. C. Patients at risk are those with lack of oral care. And D. Parotitis is inflammation of the parotid gland. Explanation. When you say itis, remember inflammation. Parotitis is painful inflammation of the parotid gland. This gland is located between the ear and the jaw. Patients at risk are those with lack of oral care or poor fluid intake. An unexpected elevation in temperature, 102 degrees, after an intestinal endoscopic procedure, such as an EGD, should prompt the nurse to select all that apply. A. Suspect perforation. B. Assess the patient. C. Document the finding in the record only. D. Contact the healthcare provider. The correct answer is A. Suspect perforation. B. Assess the patient. And D. Contact the healthcare provider. Explanation. Perforation is a risk of gastrointestinal endoscopic procedures. After the procedure, nurses and patients should be vigilant for an unexplained high temperature, even in the absence of abdominal pain. What are some examples of lifestyle changes that a patient can make to reduce the symptoms of GERD? Select all that apply. A. Avoid wearing constrictive clothing, especially around the waist. B. Avoid water after 7 p.m. C. Limit late-night snacks and carbonated drinks. D. Avoid laying down immediately after eating. The correct answer is A. Avoid wearing constrictive clothing, especially around the waist. C. Limit late-night snacks and carbonated drinks. And D. Avoid laying down immediately after eating. Explanation. Gastroesophageal reflux disease symptoms can be lessened with lifestyle changes, such as changing one's diet and avoiding laying down immediately after eating. Weight loss may help, and one should avoid wearing constrictive clothing. The nurse is assessing a 33-year-old male patient with heartburn. Heartburn is a symptom of, select all that apply. A. Gastric tumors. B. Esophageal tumors. C. Gastroesophageal reflux. D. Hiatal hernia. The correct answer is C. Gastroesophageal reflux disease, or GERD, and hiatal hernia. Explanation. Heartburn is a burning pain and discomfort in the epigastric region and chest that occurs commonly with GERD and in some cases of hiatal hernia. Some patients with hiatal hernia have no symptoms. Hiatal hernia is a condition when a portion of the stomach pushes up through the diaphragm, esophageal hiatus. A patient is admitted to the hospital with anorexia and suspected pancreatic cancer. What is jaundice? A. A yellowing of the skin. B. A yellowing of the sclera and mucous membranes. C. A condition characterized by purpura. D. A condition caused by high bilirubin in the blood. The correct answer is A. A yellowing of the skin. B. A yellowing of the sclera and mucous membranes. And D. A condition caused by high bilirubin in the blood. Explanation. Jaundice is a condition with yellowing of the mucous membranes and the skin. It is due to bilirubin pigment and may arise with liver disease or when there is a blockage of the bile duct. Blockages may be due to stones or tumors. In a patient with jaundice, where does the primary source of bilirubin come from? A. The breakdown of red blood cells. B. Breakdown of lipids by lipase. C. Breakdown of starches by amylase. D. Breakdown of immunoglobulins. The correct answer is A. The breakdown of red blood cells. Explanation. Bilirubin is a byproduct from the normal breakdown of red blood cells. B. Lipid breakdown by lipase results in fatty acids. C. Starch breakdown by amylase results in smaller sugars. A patient is admitted to the hospital with painful stomatitis. What is stomatitis? A. Inflammation of the mouth. B. Inflammation of the esophagus. C. Inflammation of the fundus and stomach. D. Inflammation of the rectum and anus. The answer is A. Inflammation of the mouth. Explanation. When you see itis, remember inflammation. Stomatitis is painful inflammation of the mouth and may be accompanied by sores and irritation that make it uncomfortable to drink and eat. Trauma and infection may cause stomatitis. New onset of sharp upper abdominal pain in a patient with a history of peptic ulcer disease should prompt the nurse to select all that apply. A. Provide PRN pain medication. B. Suspect perforation. C. Assess the patient. D. Contact the healthcare provider. The correct answer is B. Suspect perforation. C. Assess the patient. And D. Contact the healthcare provider. Explanation. Perforation is a risk of peptic ulcer disease in patients with ulcers. If ulcers are untreated or worsen, perforation in the lining of the organ may occur. Nurses and patients should be vigilant for high temperature and sharp upper abdominal pain in patients with peptic ulcer disease. The nurse is assessing a patient admitted to the hospital with hernia. Treatment of hiatal hernia includes select all that apply. A. Weight loss. B. Medications. C. Dietary restrictions. D. Surgery. The correct answer is A. Weight loss. B. Medications. C. Dietary restrictions. And D. Surgery. Explanation. Treatment of hiatal hernia includes all the choices listed: weight loss, medications, dietary restrictions, and when these fail, surgery. Some patients with hiatal hernia have no symptoms. Medications used include proton pump inhibitors and antacids. The nurse is assessing a new patient with suspected gastroesophageal reflux disease. Medications for gastroesophageal reflux disease include: select all that apply. A. H2 receptor antagonists, for example, cimetidine, famotidine. B. Omeprazole. C. Proton pump inhibitors. D. Pancrease. The correct answer is A. H2 receptor antagonists, for example, cimetidine and famotidine. B. Omeprazole. And C. Proton pump inhibitors. Explanation. The treatment of GERD includes lifestyle changes and several medications, for example, H2 receptor antagonists, cimetidine and famotidine, proton pump inhibitors, omeprazole, pantoprazole, and antacids. D. Pancrease is a medication that contains digestive enzymes to help break down food. The nurse is discharging a patient with gastroesophageal reflux disease. How does the medication, cimetidine, work? Select all that apply. A. It is a proton pump inhibitor. B. It is a histamine receptor antagonist. C. By blocking H2 receptors on the parietal cell. D. It inhibits acid secretion. The correct answer is B. It is a histamine receptor antagonist. C. By blocking H2 receptors on the parietal cell. And D. It inhibits acid secretion. Explanation. Cimetidine is prescribed orally in some cases to treat GERD. It is a histamine 2 receptor antagonist that works by reducing gastric acid secretion. A is incorrect. PPIs inhibit the parietal cell hydrogen potassium ATP pump. The nurse is discharging a patient with gastroesophageal reflux disease. What are the adverse effects of frequent antacid use? Select all that apply. A. Jaundice. B. Constipation. C. Hyperamycemia. D. Elevated magnesium and aluminum in patients with renal failure. The correct answer is B. Constipation, and D. Elevated magnesium and aluminum in patients with renal failure. Explanation. Antacids may be used to relieve upset stomach and heartburn. Adverse effects of this medication, especially when taken in excess, include constipation, nausea, fecal impaction, and electrolyte abnormalities. The nurse is caring for a patient after gastrectomy. When can most patients resume 3 meals per day after gastrectomy, partial gastrectomy surgery? A. 3 to 5 days. B. 2 to 3 weeks. C. 3 to 5 months. D. 6 to 12 months. The correct answer is D. 6 to 12 months. Explanation. Patients who have undergone gastrectomy will resume meals by starting with 6 or more small meals daily. The food should be chewed well. It is recommended that protein is consumed with each meal, and the patient should inform the healthcare provider if they begin to lose weight. The nurse is caring for a patient after gastrectomy. What positional changes can be made to reduce the risk of dumping? A. Walking for 15 minutes after eating. B. Reclining for a period after eating. C. Standing for 20 minutes after eating. D. Lateral decubitus position for 15 to 30 minutes after eating. The correct answer is B. Reclining for a period after eating. Explanation. To reduce dumping, patients will try to reduce the transit time that the food moves. Patients may recline or remain in low Fowler's position for a period after eating. A and C may increase the symptoms of dumping syndrome. What dietary changes related to liquid intake during meals can be made to reduce dumping? A. Drink 8 to 16 ounces of water with meals. B. Drink liquids prior to consuming solid food. C. Consume roughage salad prior to meals. D. Limit fluids during the meal to slow the transit of the food. The correct answer is D. Limit fluids during the meal to slow the transit of the food. Explanation. Dumping may occur in patients who have had gastric surgery to remove a portion of the stomach. The food moves too quickly from the stomach into the intestine. Drinking between meals rather than during meals may reduce symptoms. The nurse receives a patient from the operating room after gastrectomy. What is the best position to put the patient in after gastrectomy? A. Supine. B. Trendelenburg. C. Low Fowler's. D. Sims position. The correct answer is C. Low Fowler's. Explanation. Low Fowler's position reduces postoperative abdominal pain, back pain, and the risk of aspiration. It may be used post-procedure for these reasons. Low Fowler's position is often referred to as the sitting position. The nurse receives a patient from the operating room after surgery. The advantage of Low Fowler's position after abdominal surgery is A. The patient is lateral. Should he or she vomit? B. There is no advantage. C. It reduces the risk of bleeding. D. Low Fowler's relaxes the abdominal muscles. The correct answer is D. Low Fowler's relaxes the abdominal muscles. Explanation. Low Fowler's position reduces postoperative abdominal pain, back pain, and the risk of aspiration. Disadvantages of Low Fowler's position include a decrease in venous return and an increased risk of venous embolism. Why is irrigating an NG tube post-gastrectomy by anyone except the surgeon ill-advised? A. The NG tube may be irrigated by the nursing staff. B. Irrigating the tube may disrupt the suture line. C. The NG tube may be irrigated by the UAP. D. Irrigating the tube may cause vomiting. The correct answer is B. Irrigating the tube may disrupt the suture line. Explanation. After gastrectomy, the nasogastric tube is used for decompression and to prevent postoperative ileus. Immediately after surgery, the new suture line is at risk for disruption.